Next Step in Care is an initiative of the United Hospital Fund, and they produce useful guides around different areas of healthcare. And their latest guide has to do with explaining the role of hospitalists. Hospitalists now play a role that your primary care physician used to in hospitals, so at least for those of us who are able to remember. Not that I've been hospitalized but once for tonsils having been taken out, but in the olden days, your primary care physician would be very aware that you were hospitalized and would come and visit. Well, that doesn't happen anymore. A physician called a hospitalist does. And so this brochure provides some information about hospitalists, actions to take, questions to ask, but also tells you that each hospital has its own policy regarding hospitalists. My mother was hospitalized a while back, and she had a hospitalist come in, and he's this handsome guy and charmed her and all this kind of stuff, and so she thought he was great that way. I particularly wasn't all that enamored because they have so many patients that are responsible for. They're in and out within 3 or 4 minutes. There's just no way that a hospitalist is giving you the type of care if your primary care physician had an incentive to actually come to the hospital and spend some time with you. Physicians used to have to block that out and actually do that. I'm not convinced of the effectiveness of the hospitalist, at least as I have seen it in action, and I work in hospitals as well, and so I could obviously be going off of one personal incident. But if you want to know more about hospitalists, we'll put a link and you can look for yourself, and hopefully you will never need it because you will stay out of the hospital. Thank you.